interest in patient safety was really ramped up after the death of my son in 2002. And you will hear his story when I tell it in a bit here. And I knew that we needed to reach the gut, as Helen said. And we can only do that, I think, by living the experience of the patients and families, by hearing that experience. So that's why I agreed to be on this panel. Thank you.
And I'm Jerry Bell, the manager of the emergency department here in Regina at the Pasqua Hospital. I'm here to share the journey that I've taken with Donna and the loss of her son, and to talk about some of the very basic things that we're looking at in our departments in Emerge that can make a difference to the quality of care that we're providing our patients. And I think it's, and I'll open later with one phrase that I heard from Donna, and that is the passion that I have left, is to move that energy forward. And when we talked about energy, that's why I'm here, to try and move that energy forward.
Vance's story is very long. There's many facets to it. It's about a multi-system breakdown that resulted in his death. So I don't have time today to tell you that. So I chose to read to you an article that I wrote when I was on the Canadian Patient Safety Institute working group, where we developed the Canadian Framework for Teamwork and Communication. And you can find this document on the Canadian Patient Safety Institute website. So I'm going to do something I've never done before. I usually just speak from the heart, off the cuff, without notes, without slides, other than the video. And I'm going to read you what I wrote. As a parent, it is always at the back of your mind that your child may be hurt in some way, sometime. Being the parents of 4 children, we were no different and had been through the usual broken bones, bumps, and bruises. This time, though, it was much more frightening. The fear that coursed through me when our only son had the motor vehicle accident and was missing for over 30 hours was like nothing I'd ever encountered before. But it was going to be okay now. He was in the hospital under the care of experts who were familiar with head injuries such as his. It is just a minor head injury that is going to take time and rest, I'm told, over and over again. I believe them because I want so desperately for it to be true. I am concerned, though, because it seems that staff is not hearing what I am telling them about my son and about the accident. All they could hear, although they didn't hear it from me, all they could think about was alcohol. He's 19, he must have been drinking. I still have confidence everything will be fine. After all, his injury is minor. But I am becoming more concerned. I notice my son's condition is deteriorating, but the staff do not hear my concerns. I am respectful and cautious in voicing my observations to the staff. I know they are busy with many demands to meet. I don't want to alienate the people who hold my son's life in their hands, but I am so scared. My mother's intuition and love for my son is telling me something is terribly wrong, but no one will listen. My nursing background is telling me something's wrong too. The physician is too busy to speak with me. My concerns are dismissed or explained away as irrelevant. I know my son better than anyone else. Why won't they listen to me? I am so scared I can hardly think. There is a knot in my stomach and a physical pain in my heart that is a foreboding that something terrible is happening. I see him dying before my eyes. I'm his mom. I'm supposed to protect him, but I can't get anyone to help me. Now he is brain dead. My young, handsome, hard-working son is never going to phone me again just to say, "Hi, I love you." He will not play hockey, ride a horse, and spoil his little niece. He came into this world in my arms. I want to hold him in my arms one last time, but the side rails are up, the bed is up high, and there are machines and tubes everywhere. I just want to hold him close to me, but I can't. no one will help me. The silence I encounter in this busy healing place is deafening. Staff hurrying everywhere, yet I have never been so alone in my life. Why did this have to happen? If only someone had heard and acted on my concerns. If only the staff had communicated his deteriorating condition with each other. If only the environment had valued the assessment and evaluations of novice staff as well as senior staff. If only an effective handoff had taken place. The if-onlys won't bring our son back or heal our broken hearts. But I hope by reading this experience and by you hearing it here and using the guidelines of the teamwork and communication document that CPSI developed, we can all work towards care that will prevent another mother's heart from breaking. Effective teamwork and communication with family and loved ones are so important to the outcome we all want for patients. The communication is a two-way process, with the family receiving the information they need and feeling comfortable in speaking up with information or concerns they have. The organization needs to support this environment, recognizing it as a necessary component for patient safety and a satisfying patient and family experience. We can't undo what has been done. We can't get back what has been lost. But we can learn from this and all the other patient experiences if we make a conscious effort to include the patient and family, not after the fact, but at the very beginning of the interaction with them. We needed, as a family, we needed the acknowledgement after Vance died that something significant had happened. We needed the hospital and the organization to say, we recognize that this shouldn't have happened. And we needed to know that there was improvements that were going to be made. But in order to do that, they had to first acknowledge that something had happened. You cannot fix what you don't acknowledge. We wanted all this so that we could make sure that the patients and the families who come behind us in the system don't experience what we did. We were left unsatisfied. There was no talking, there was no acknowledgement until 6 years later when we met with the hospital. Not the same people, of course, but we got to talk to them and talk about improvements that needed to be made, and I think it opened their eyes. A call from Paula Beard, who many of you might know. She was the risk manager at Regina, and when she called me, she was with the Canadian Patient Safety Institute, and she said the words that changed my life. She said to me when she called, "Donna, we failed Vance in our care of him, and we failed you as a family." And that gave validation to what I had always known to be true, but now I could go out and I could advocate for that change. And I did. The day after Paula called me, I called the University of Saskatchewan. Google's a wonderful thing. And I called them and I said, "Do you teach patient safety to your medical students?" No. Well, maybe. I said, "Well, do you invite guest speakers to come in?" "Yeah." And I said, "Well, I think I have a message that your students need to hear." So I invited myself, and I drove the 6 hours to Saskatoon, and I spoke to them. And I thought, well, it was received really well. And I thought, if I never get asked back, I guess, we'll just go somewhere else. I've been asked back every year since 2008. I would like to ask you, I know we've made great improvements, but I just want to challenge you all, don't stop.
Yep.
Don't think we're at the place we need to be, because we're not. Because today, another patient got a hospital-acquired infection. Today, another patient was made to feel guilty for being at an emergency department. Today, someone's son or daughter or mother or father died because of care that we gave them. And I have the spiritual energy that Helen talks about. I have the hope that we can change this. And part of the hope that I have is because of Jerry sitting beside me. And Jerry is a very important person in our life. We met him when Vance died, as the coroner in charge of his case, but also as a nurse educator.
Well, so I want to say that every time I hear Vance's story, it actually brings back a huge number of memories that I have in speaking with Donna. There's one comment that Donna made to me early in our relationship of understanding what happened with Vance's life and death, is she said, how dare they make me feel so guilty that I didn't fight harder to save my son. And the passion that I have in doing this is I watched the audience during the story, and if you could all have seen how many people were wiping their eye or were thinking deeply about the story that was being heard, that is the reason that we are here today. That is the reason that we have to not give up and we try and move forward. It's a very complex situation. I make the analogy of a picture, and every little bit of improvement is just one piece of a picture. And once we get all the pieces put together, we'll be able to see what it is that we were working towards. But it'll take a lot of time. I do believe that one of the passions that we need to grab hold of as nurses, as healthcare providers, is working towards acknowledging the vulnerability that we have when we have to start admitting that there was some wrong, or the feeling that we don't have the answer, but everyone thinks we should have the answer. So the comment that I talked about where we have put healthcare providers into a conflict is we put up posters in our healthcare agencies that say it's safe to ask, it's okay to ask, and then we, the people that they're asking, feel vulnerable and we don't carry out the action of providing the answer. We're afraid. And so I think we have to give healthcare providers permission to not know answers, permission to be feeling vulnerable. But I also think that what we have to do is put into check the attitude, the prejudice, and the bias that we bring with us every day to work. And if we could get rid of those attitude, prejudice, and biases and listen with good ears when our patients and our family are talking, we can make a difference in healthcare and we can improve the quality of care we're providing. I do believe that I have worked ever since coming to know Donna. I have worked with an internal struggle that I have, and that is that I believe that I'm privileged to be able to work in the public's healthcare system. And the struggle I have is trying to not make healthcare a customer service, customer relationship thing, but rather a passion that we all have in healthcare. And so I know as I lead my team through many journeys where we have our goods and we have our bads, I try to help us understand that it is a privilege to do what we do as healthcare providers. It's not a right. We have a privilege. I do believe that we have to understand critical inquiry versus critical thinking. We have to make sure that we're listening to what the patient is saying and seeing if we are putting their puzzle together properly. I heard or I read a quote from Abe Lincoln, and it's something that I try and carry with me all the time now, and that is, I don't know that man, I need to get to know him better. And I think if we all could see one small piece of change that we could make in someone's life, we can bring back healthcare to that quality and the improvements that we truly are talking about making, and the public will see the difference that we're making. I do believe we are making a difference. I do believe that we're improving healthcare, but it's going to take challenges and it's going to take courage. So when we talk about the fear in that fire, I don't know where I'm at in that fire, somewhere in the middle maybe, trying to get away from fear in the personal fire underneath me to turn on a burning desire to try and make a change. So I want to tell you that it was one small piece that we did in our particular area of healthcare when Vance's death occurred. We created a stop sign within our electronic system, and that stop sign simply said, if we apply the stop sign, no one is to admit, discharge, or transfer the patient until we find out who put it on, what was the reason that it had to be put on, and have we got rid of the problem that caused us to put it on, or did we acknowledge we can't get rid of the problem? The next part of this is it's easy to create these stop the lines, to create a flag, to create a stop sign, but we have to look at the human interaction that goes along with that. And so we constantly work and struggle with why that stop sign is there, and are we truly looking at the intent behind the stop sign? That's the human side of what we're trying to work with now. And it did make me feel good to hear Donna say that when she came to see the stop sign, she heard people talking about Vance's story. She heard people talk about Vance's stop sign. And I do believe that we are making a difference. I do believe that we did listen. And I do believe that with every small piece, we will try and put a picture together and make a difference.
If I could add, it can be something as simple, and it takes no time hardly, to turn the clinician, the nurse, the physiotherapist, whoever, turn to that loved one sitting at the bedside and saying, how do you find Vance today? And then listening to what they say. And I'm just going to tell a really quick story. Our daughter Deidre, she was severely ill. She's up on the ward and she's doing well. And a young nurse came in and she said, so Deidre, how are you doing today? And Deidre told her. And then the nurse turned to me and she said, and are you Mum? And I said, yeah. And she said, how do you find Deidre? Do you think she's improving? And with that, I burst into tears. And she thought she had done something terrible. And I said, no, you did everything right. And then, of course, I had to tell her our son had died. And if only someone had turned to me at that bedside and said, how do you find Vance today? And then listened. So listening to the patient. We as nurses, clinicians, doctors, physiotherapists, we are the experts on our profession. At least we like to think we are. But the patients are the experts on them. The family sitting at the bedside is the expert on their family member who can't speak for themselves.
Yeah, in going along with the theme that Donna's talking about, I think that the one challenge we have as healthcare providers is how do we personalize and internalize what is happening to that patient and family? And as soon as when I talked with my team about something that could have gone better, I say, it doesn't matter what your reality was and what the facts were. Tell me why the patient felt that this didn't go well. And as soon as we can internalize that, wow, if I were that patient, yeah, maybe I wouldn't have wanted to. And so it's this culture shift that we work with them and see that it's risk-free and that there is no risks when we do that with our patient and family. It actually is a wonderful experience.
I guess in closing, I would just say, don't ask if you can use this information. Ask, how can I use it tomorrow? How can I do things a little bit different in some way tomorrow? Your next interaction with a patient or a colleague or a family member, reflect on it and how can I use that information? All of it that you hear at the conference here. Thank you very much for this opportunity.